skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. And I'm Jasila Mujib, your host for today. Today we will be discussing about high blood pressure or hypertension, and we are delighted to have with us Dr. George Anthony from Al Hilal Hospital, Rifa. He is a specialist in internal medicine, and without losing time, let's move on to the doctor. So doctor, welcome to the show.
Thank you, Jasila. It's nice to have me on board here, and I look forward to this experience.
Thank you, doctor, for joining us today. So, doctor, how do you describe hypertension or high blood pressure, and how relevant is it nowadays?
So, blood pressure in common man's terms, it means it's actually the pressure exerted by the blood on the walls of the artery when it travels to the different parts of the body. So this is very important because it is via this blood pressure that the blood gets to travel to various parts of the body and reaches the vital organs. So that is why blood pressure is important.
So doctor, what is the normal blood pressure and what are the variations?
Okay, but if you go by textbook terms, the normal blood pressure value is 120 over 80. So, but this is not a strict norm because this normal variant, there can be normal changes in the blood pressure, especially diurnal variations. Blood pressure can vary with age. It can also vary with seasons, and also in the same day, as I said, diurnal variations can happen to the blood pressure. And also if you examine a patient after physical activity, the blood pressure may show some changes. But strictly by going by the textbook, it is 120/80 millimeters of mercury.
So doctor, what are the consequences of having high blood pressure? Can you explain for us now?
Yeah. So blood pressure is very, very important. Like I said, blood pressure is needed for the vital organs to get oxygen and various other essential nutrients. So what happens when there is a high blood pressure? We all see that, especially us doctors in our clinical practice, we see that high blood pressure is associated with various catastrophic events, especially heart attacks, strokes, kidney failures, and also various other catastrophic events. So that in that regard, controlling the blood pressure is very, very important.
Doctor, now we would like to know about the common symptoms and also the frequent uncommon symptoms of high blood pressure.
So that is an interesting question. So interestingly, if you notice, we would see that most of the patients might not have any symptoms at all. They might continue to live with high blood pressure without even knowing that they have high blood pressure. That is why blood pressure is often referred to as the silent killer. But in rare cases, when the blood pressure exceeds 180 over 120, that is what is known as hypertension crisis, then at those times, patients can experience symptoms such as headache, palpitations, tingling and numbness, etc.
So we know that there are two types of hypertension. Can you explain it in detail for us?
Yeah, so broadly speaking, hypertension can be classified into primary hypertension and secondary hypertension. So as the name indicates, primary hypertension is hypertension de novo without any specific cause. This might be due to genetic patterns of the individual. This can be due to the various lifestyle patterns that the individual follows, including erratic dietary habits, lack of exercise, etc., so on and so forth. But coming to a secondary hypertension, that is always when the patient has an underlying medical condition. Okay. It could be a cardiac condition, it could be something to do with the kidneys, or it could be also secondary to certain drugs that the patient might be using.
Now, can you explain about the common causes and risk factors associated with?
So we can say that there are certain important risk factors for hypertension. One being overweight or obese. Second, the ethnicity of the individual. A black ethnicity individual is more prone to hypertension more than a Caucasian. Then obesity, the lifestyle patterns, especially smoking and alcohol consumption, and also most importantly having a first degree relative who is hypertensive. That also can increase the patient's chance for becoming hypertensive.
Now you mentioned about ethnicity. Yeah. Can you make it more clear for us?
Most of the research studies nowadays show that genetics play a very important role in the manifestation of hypertension. So what is genetics exactly? So that is something that has to be dealt with in a very detailed pattern. So what normally we see that, Caucasians and Indian, the subcontinent, those people are, when you compare with the black population is more prone for hypertension than these individuals.
So doctor, we know that hypertension is diagnosed along with some other medical conditions. So what are the tests to be done to diagnose hypertension?
So interestingly, in our clinical practice, we have patients who come with symptoms of hypertension, but this is very, very rare as we discussed earlier. We might actually diagnose hypertension when the patient has come for some other clinical conditions. And incidentally, we find that the blood pressure is high. So the easy answer to this is the only way you can diagnose hypertension is getting your BP, the blood pressure checked regularly. It could be at home or it could be at a healthcare center. I would advise my patients to actually, check the BP at home, and if they find any erratic values, they can actually go and consult their healthcare provider or family physician.
Now, which are the different stages of hypertension?
Yeah, so when you talk about the different stages of hypertension, when we describe BP, there are two values. There is a number above and a number below. So the number above is what is known as the systolic blood pressure, and the number below is called the diastolic blood pressure. So what is systolic blood pressure? What is diastolic blood pressure? Systolic blood pressure is the pressure exerted by the blood when the heart is actually pumping blood outside. And the diastolic pressure is the pressure exerted by the blood on the arteries when the heart is at rest. So there are two values that we have to look into. So normally, as we mentioned earlier, it is 120 over 80. So high blood pressure is something that is between 120 to 129 and over 80. So that is classified as high blood pressure. Now, as per the American guidelines, we have stage 1 hypertension and stage 2 hypertension. So what are these? Stage 1 hypertension is a systolic blood pressure between 130 to 139 and the diastolic blood pressure between 80 to 89. And stage 2 hypertension is blood pressure above 140/90.
So, doctor, once diagnosed with hypertension, what are the treatment options?
I would, as in my practice personally speaking, I always encourage the individual to follow some lifestyle modifications before actually making him embark on a journey with drugs. So I would always stress on the importance of diet modification and exercise. So when it comes to diet, there is a specific diet for hypertension known as a DASH diet. Okay. So that is a dietary approach to stop hypertension. That is a full form of DASH. So that includes low fat, low calorie milk or any other dairy products, more of fruits and vegetables importantly, legumes, and also consuming whole grains. So this is what is a DASH diet. And also small quantities of food over time is helpful in the control of BP. And when it comes to exercises, both aerobic training and also weight training is important. So when it comes to aerobic training, what we advise is at least 150 minutes of walking or any activity in a week. This is some of the methods by which we can control the blood pressure.
Now, can you make clear the connection between smoking and hypertension?
Yeah, so if you are a smoker, I would advise you to stop smoking today. So there is no excuse for that because smoking itself can cause various heart problems and other stroke, and as we all know, smoking itself causes decreased blood flow by vasoconstriction, and this along with hypertension can augment the whole issue. So hypertension and smoking together can wreak havoc. So I would advise my patients to stop smoking if they do that, and also along with this, cut the consumption of alcohol.
Okay. So with treatment, can we stop the medication in between, or do we have to take the medicines throughout life? I mean, is the hypertension, once we diagnose it, is it lifelong?
Yeah, so that is why I was telling you that once a patient comes to me with high BP values, I would not straight away start with medication. I would ask him to come for 1 or 2 more sittings. I would take the average blood pressure and then only decide whether to start him on medications. And that too, even only after, I explained to him the importance of lifestyle modifications. Even after that, if the blood pressure is too high, I would actually recommend starting medications. And one important thing I would like to tell the patient and the audience is that never stop the medication by yourself. Okay. Once you start a medication, you have to be always in touch with your physician, and only on his advice would you consider changing or stopping a medication.
Okay. Is there a chance of reducing the medication?
Yes, definitely there is a chance of reducing the medication, provided he follows a lifestyle pattern and also cuts down his dietary erratic lifestyle.
So doctor, can you describe about the role of supplements and medication in hypertension management?
So when it comes to medications, there are 4 classes of drugs broadly. These are the AC inhibitors, the ARBs, and the calcium channel blockers, the CCBs, and also last we have the diuretics. So these are 4 classes of drugs we usually use to tackle hypertension. In addition to this, the physician might use a combination of medicines so as to get a target BP of such and such a value. Maybe all these drugs by themselves could not attain the target BP. So what we use is we use a combination of medicines so that we can keep the blood pressure at a low minimum. Coming to the second part of your question, supplements, I would not, go for supplements per se, because there are no clinical evidences that suggest the use of supplements in the management of hypertension. People do advise pre and probiotics for this and various other agents, but there is no clinical trials that have shown their efficacy.
Doctor, another common query is the connection between stress and hypertension. We know that stress level will increase the hypertension also. Yeah. So what is your suggestion? Yeah, so stress, definitely it has been proven that stress and hypertension is a vicious cycle. So when a patient experiences stress, his BP levels will naturally go up. And also this has also got an indirect connection with the sleep levels also. So sleep, stress and hypertension go hand in hand. So one has to tackle the stress either by medication or by lifestyle changes to bring down the BP to expected levels. And doctor, how often should the patient visit the doctor regarding hypertension?
So basically, broadly speaking, if you are a healthy individual with no other comorbidities, I think only a yearly checkup is enough for checking the BP. But in case you have other medical ailments too and you have been already diagnosed with hypertension, I would say that a visit every 3 months or even a shorter interval is prudent. So this all depends on an individual to individual basis. So we can't just generalize it on a whole. Okay. So this is a case by case basis.
And doctor, what is your advice for our viewers about hypertension?
So to sum it up, I would say that hypertension is a very serious yet silent killer. It can catch you unaware and you might not know that you are even hypertensive unless you land up in various catastrophic health ailments such as a stroke or a heart attack or a cardiac failure, so on and so forth. So my advice for you is to make timely visits to your doctor, have proper health checkups, check your BP at regular intervals and make sure that your numbers are well controlled so that they don't progress beyond a certain level and they don't end up in complications. So if you do that, and also coupled with that, if you have your proper lifestyle changes in place, I think we are good to go and I think your blood pressure will be in good check.
And finally, doctor, what do you have to say about Al Hilal Healthcare Service? And what are the services you offer at your hospital at Rifa, especially in your department?
Al Hilal has been a successful group in Bahrain. We've got almost 9 centers. I personally work at Al Hilal Rifa, which is one of the oldest centers. There at Rifa, we have got almost all the major specialties, including internal medicine, OBGYN, general surgery, ENT, ophthalm, dermatology, and also we've got a full-fledged dental wing also. In addition to this, we've got a 24-hour functioning emergency department, which is managed by skilled general practitioners. We at Al Hilal look forward to treating you all, and we always would like to welcome you to come and share your health concerns, and we are always there to share our expertise and knowledge to help you lead a healthy life. Before I conclude, I would like to thank the management at Al Hilal, especially Dr. Sharath, the CEO, and Mr. Tony, the admin at Rifa, for giving me this opportunity to come on air and speak about this interesting topic of hypertension to the people of Bahrain. Thank you. Have a good day.
Thank you, doctor. Thank you very much.
You're welcome.
So, viewers, as doctor just now mentioned, hypertension is called a silent killer as it causes many complications without any obvious symptoms. So if you or your loved ones have any symptoms of hypertension, go for medical intervention on time and improve the quality of your life. Till we meet again next time, this is Jessila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.